I feel like kind of PMS is like a BS term of like what they created, men created for women to just say like they're hormonal.
Yeah.
'Cause
What are the differences between PMS and PMDD?
PMS is I feel like kind of PMS is like a BS term of like what they created, men created for women to just say like they're hormonal.
Yeah.
Because PMS is where we start to see that increase in just, mood swings or mood variability. Typically like those highs and lows are more easily agitated. A little bit more, emotional leading up to our period, which is often more correlated with the fact that either you don't have enough progesterone at all,
Mhm.
or your progesterone to estrogen imbalance or ratio is a little off, right? So maybe
Right.
progesterone tanked and then estrogen's not filtering out properly. So we have this big discrepancy that is
Mhm.
heightening those mood disruptions. Now, PMDD, this is where, and because I remember again in my own journey going into this space where one doctor was like, she just has PMDD. And I was like, oh, they didn't do any tests for it, right?
Yeah.
They didn't check my hormone levels to confirm it. They just called it this really, really severe version of
Mhm.
PMS. That's how they defined it to me. And even now in the literature that I've done for my reviewed for my clients, it seems very much that it's just kind of that, like, oh, it's just a very severe case of
Mhm.
PMS to the point
Mhm.
where they almost have, I used to joke, I called them like my rage blackouts. I just
Yeah.
get like so
Yeah.
angry and I didn't even know why. But again, I do believe that's still more correlated to the fact that there is some type of systemic hormone imbalance that is happening at a particular time of your cycle. Because both of those scenarios, they only flare in your luteal phase, right?
Wow.
Then they typically, the traditional course of treatment or action in our medical world is to just say like give a woman birth control because
Right.
the belief is that that synthetic estrogen and progesterone is going to like kind of just numb it, right?
Mhm.
So clearly both are still very, very, very correlated because if that synthetic hormone can fix it,
Mhm.
then real hormone probably could fix it and like
Yeah.
I don't want to say cure it, right? You're not supposed to
Yeah.
say cure it anywhere, but like to that
Yeah.
extent. And if you look at those supplements, right? I mean, you probably know even more than me, right? But when you look at those supplements that are out there, it's typically nutrients like B vitamins,
Yep.
nutrients like vitamin E, magnesium, vitamin D. All of those nutrients, I know off the top of my head, are huge, huge progesterone production supporters.
Yep. Switch gears. There's a couple of other things to talk about. This was, not on the list per se, but I do think it's really interesting to ask. And maybe with your practice, you see men, maybe you don't. I would love to talk about men's hormone health because we have in recent interviews pertaining to fertility, right, talked about men's hormone health. But so this is a wild card question. I don't know if you see men or not, but what are some of the issues right now that men are facing with hormone health and metabolic health?
Again, men have a 24-hour hormone cycle. So what happens is basically the clock strikes midnight and they magically they magically reset, which is wonderful for them because it does provide that repeatability.
Mhm.
However, at certain times of the day, you see different influences of things like cortisol and testosterone, which are the primary drivers
Mhm.
of their just whole system function. And a lot more men than you think are dealing with high cortisol as well,
Mhm.
right? And a lot of it is related to, I don't want to say the same exact thing, but there is a lot of pressure on men
Mhm.
to perform, or depending on, I think of our particular situation. My husband still travels for work.
Yeah.
He still they typically have jobs that are a little bit more demanding than
Mhm.
women just because of how our society is structured.
Mhm.
um, and so we're seeing a ton of that. And where it starts to stem off is, men do produce more of their testosterone in their gonads, in their
Mhm.
testes. However, there still is DHEA production. And then downstream, they can either have an overconversion of testosterone into dihydrotestosterone. So it's not usable, it's not viable for them. Or if they're starting to take, and this is huge, men just get, yeah, this happened with so many men. They get told like, oh, your testosterone low, your energy's low, your libido's low, let me just give you testosterone. Guess what? Their testosterone production system shut down the minute they get on testosterone. The minute they start those shots, they can never get off of them.
And that's you're referring to the, like, TRT, right? The
Yep,
testosterone replacement
TRT.
therapy, yeah.
Yeah.
And the other thing that's so important to know about TRT is that it really can negatively impact fertility.
That's huge. I mean, we were again speaking to it at our annual physicals with our doctor, and we were talking about
Mm,
like, okay, what are the impacts on fertility? What are the impacts also on testicular cancer, right? They're
yeah,
giving it to men younger and younger now, but it's like they're
yeah,
still in that prime age, I think up until 35, where they're at a
right,
huge risk of testicular cancer, and yet they're giving them TRT. And we were starting to think
yeah,
like, okay, this doesn't seem smart. But the other downstream, which is overlooked in men, especially if they're on TRT or any type of supplement that's going to increase testosterone, is estrogen. Because think about it,
mm,
if typically the biochemical process to increase testosterone, especially if it's just supplementation versus TRT,
mhm,
is to increase DHEA production. And then DHEA
mhm,
gets split and either gets created into estrogen or testosterone. Obviously, percentage changes, depends on men or women. So there can be instances where there's increased estrogen production and then estrogen
mhm,
dominance as a byproduct, right?
mhm.
Um, and I do think that's overlooked in the same way that low testosterone is overlooked for women.
Instead of going through testosterone replacement therapy, what would you say to that man? What are some of the best things that they can do to naturally increase their testosterone production?
So one, same with women.
Mhm,
Again, it's the same conversation around fertility, men's fertility and women's.
mhm,
Are you eating enough for your body to feel safe? Again, it's
mm,
different for men because it's not
yeah,
like they have to help a human grow
yeah,
per se. However, if they're not getting enough nutrients, more so what's going to happen for men is the gut is going to be disrupted via the gut brain axis.
mhm,
And then that inflammation, degradation of the gut lining is going to influence their body's ability to absorb and utilize testosterone.
yeah,
Right. So in some situations, it's not so much a production issue. It's a, hey, your gut is super inflamed. Right.
mhm,
Also looking at okay, overall systemic inflammation in the body as well. Are you eating whole foods? Are you trying
mhm,
to avoid processed foods if they're traveling a ton? Making sure
mm,
that they get enough fiber
mhm,
and reducing any foods that could potentially be inflammatory for them. I don't believe in
mhm.
blind inflammation. Same with women.
Yeah,
But are you eating dairy when you're
yeah,
like men are more likely to do this than women, I feel.
yeah,
They know that they're lactose
and
intolerant,
just
that they're like, I'm still gonna
yeah,
eat it, and then they do.
yeah,
And it's like, okay, that's a huge factor.
yeah,
Um, Another consideration, some of these are super well studied, some of them are not, and
mhm,
you have to be really mindful in how you introduce these supplements because they are cyclical in nature. But taking things like Fadoja and Tongkat Ali
mm,
have been shown in some clinical studies to be effective at boosting, but also things like making sure you're taking enough zinc, vitamin
yeah,
D, magnesium. Again, those are core supplements. That could impact, especially if there's nutrient gaps and individuals not eating enough or there's a ton of inflammation in the body.
mhm,
Um, and then both for men and women, lifting weights, right? That is the single most impactful way to reduce circulating cortisol levels as well as to improve testosterone production in the body. And both are super receptive to it, both men and women.